Good evening. My name is Tim Andrews, and thank you for joining our live interactive telephone town hall. We are hosting tonight's event to give Congresswoman Spanberger the opportunity to hear directly from you and to answer your questions about the issues facing Central Virginia families, businesses, and communities during this pandemic, particularly as it relates to mental health and addiction challenges. Now, as I mentioned, this is an interactive forum. Congresswoman Spanberger and Virginia mental health experts will be taking as many questions as we possibly can during this event. If you have a question, you can simply press *3 on your telephone keypad at any time, and you'll be placed in line to speak with a member of our staff. They're going to take down your name, the area you're calling from, and the next time you hear your name, you will be live on the call and able to ask your question directly. Now, you can also ask a question by submitting one through the portal right below our online streaming player at spanberger.house.gov/live. Again, that's spanberger.house.gov/live. Now, if you're watching on Facebook Live tonight and wish to ask the Congresswoman a question, we encourage you to visit our online streaming portal so you can submit your question. And again, that's spanberger.house.gov/live. Additionally, if you would like to receive updates from our office via our email newsletter, please press *6 on your phone keypad at any time, and an operator will collect your email address. Now, we could receive a lot of questions during this event, so if we're not able to address your question specifically, please call our district office at 804-401-4110 anytime during normal business hours. But again, during this event, at any time, if you have a question you would like to ask live, simply press *3 on your telephone keypad or just type them right below the streaming player. Now, please welcome Congresswoman Spanberger. Congresswoman?
Thank you so very much. Hello, I am Abigail Spanberger, and I thank you all for joining tonight's virtual telephone town hall, focused on mental health and behavioral health challenges facing Central Virginians, particularly amid the COVID-19 pandemic. Tonight's event is on a critically important topic. During the pandemic, I've had the opportunity to hear from so many of our neighbors across the 7th District, and I've heard many inspiring personal stories, but I've also heard stories of tremendous hardship and loss. And the numbers reflect that. Notably, since 2013, overdoses are the leading cause of accidental death in Virginia. And every single part of Virginia saw increases in emergency room visits for overdoses from 2019 to 2020. Central Virginia saw a 38% increase in emergency department visits for overdose. It's a challenging time for so many, and for those who were faced with mental health challenges and needs before the pandemic, I know that the extra isolation, the financial uncertainty, and the hardship caused by the pandemic has really exacerbated many of the difficulties that they face, that you face. And so tonight I'll be joined by a panel of experts who can answer your questions and hear your concerns about mental health, behavioral health, and addiction challenges here in the Commonwealth. During tonight's event, I'll be joined by Lisa Job Shields, who's the Deputy Director of the Community Services for the Virginia Department of Behavioral Health and Developmental Services, Dr. Chethan Bacciaretti, Chief Medical Officer for the Virginia Department of Medicaid Assistance Services, and Dr. Gerald Moller, Assistant Vice President of Clinical Research and the Chair of Addiction Psychiatry at VCU. As many of you might know, the House of Representatives passed the American Rescue Plan earlier this month, and President Biden signed it into law. I continue to believe that the American Rescue Plan meets the moment and gives our communities the tools they need to keep up our fight against the COVID-19 crisis, whether it's investments in increased vaccinations across the board or additional support to small businesses and restaurants as we rebuild our economy. But significantly and related to this topic of discussion tonight, the American Rescue Plan provides much needed support to programs that are meant to help those who are facing addiction, who are facing mental health challenges here in Central Virginia and across the country. Specifically, it provides an additional $4 billion for the expansion of COVID-19 related behavioral and mental health services. And with this additional incredible investment, I'm hopeful that we can build a stronger community-focused recovery that supports Virginia's individuals and families who need a helping hand, particularly during this challenging time. Often I know that the COVID-19 crisis has made it more difficult to access the necessary help and the resources that we otherwise might need and otherwise be able to access. So I hope tonight we can answer many of your questions and direct you to the resources that you may need. If we can't get to your question tonight, please do not hesitate to reach out to my office. I'm going to introduce each of our guests briefly before we continue with your questions. It's my pleasure to introduce Lisa Job Shields, who will provide an update on the issues that we're discussing tonight from her perspective. Lisa?
Thank you. Thank you so much for having Virginia DBHDS on the town hall tonight. I have a visual that I was hoping to share so that I can just provide some general information and links that could be helpful. Thank you. Next slide. Thanks. So here in Virginia, our behavioral health system is made up of 40 DBHDS-run state hospitals, 40 locally administered community services boards, and over 1,000 providers licensed by DBHDS. And we know that COVID-19 and all the other impacts of the pandemic have been impacting mental health, substance misuse, depression. We know people are struggling with things like burnout and exhaustion, and it's been causing a lot of stress and challenges for a lot of Virginians. You can go to the next slide. So the 40 community services boards have been working very hard to continue to provide the essential services during the pandemic, providing a really quick shift to telehealth, getting that up and running and using that to help with access, as well as working to ensure that face-to-face services are still available safely when they're needed. Even with all of this, with the pandemic going on, we've been working to build more services, such as same-day access and outpatient services. And I wanted to share this link that can show you how to find your community services board in your area, and then also a link that can help you find private providers in your area. Next slide. So one bright spot has been receiving federal grant funding for behavioral health support, funding that has been used to increase CSB capacity, provide protective equipment and telehealth needs, as well as specifically providing for the wellness of frontline workers. Next slide. And finally, I just wanted to end with some resources. DBHDS also received a federal FEMA grant to create the Virginia COPES Warm Line. And that's something for any Virginian to call to get listening and resources. If you're struggling during COVID-19, you can call or text. And also our Curb the Crisis website can help locate substance use treatment services. That's funded by our federal opioid response grant. So even though the work is getting even more challenging, the providers are committed to work hard and try to meet the needs of everyone here in Virginia. So thanks again for having me on tonight.
Thank you so much, Lisa. And for those of you who are listening in on the phones, we will be sending out the resources that Lisa showed on our live stream through our newsletter. We'll also be posting those on our social media platforms, Facebook and Twitter. So if you would like to get those, we'll be sending them out through our newsletter and again, posting them on social media. Next, we'll hear an introduction from Dr. Chetan Bachireddy, the Chief Medical Officer for the Virginia Department of Medicaid Assistance Services. Chetan?
Hi, good evening, everybody. Representative Spanberger, first of all, thank you so much, and thank you for those who are listening for including me in this event and sitting next to my colleagues, Lisa and Jerry here, who are true experts. My name is Chetan Bachireddy. I'm a practicing physician. I care for individuals with substance use disorders, with addiction, and I'm also the Chief Medical Officer at Virginia Medicaid. Virginia Medicaid is the insurer of almost 20% of Virginians, 1.8 million Virginians, and plays a key role in ensuring access to care for many within our Commonwealth. This year, our COVID year has been tremendously disruptive for all of us, and Medicaid has been a critical safety net for Virginians who've experienced job losses, financial hardship, and health challenges. our team at the Virginia Department of Medical Assistance Services, Medicaid, has stepped up to make sure that our members, our 1.8 million members, and those reaching out to us get the help they need. Since March of last year, our population within the Medicaid program has grown by nearly 300,000 Virginians. Almost 150,000 of those are in our expansion category. And so we're lucky in Virginia that in 2019, we were able to expand coverage through Medicaid expansion. On average, we're gaining about 5,000 new members in our Medicaid program per week. Our agency very seriously takes our commitment to health equity, and we've been working closely with our colleagues in public health, in behavioral health, and providers like Dr. Jerry here to ensure that our Medicaid members have meaningful access to the COVID-19 vaccine, and we're able to navigate them through the vaccination process. I do want to highlight something that the representative mentioned earlier in her remarks, which is that very simply, COVID-19 has worsened the drug overdose epidemic. In Virginia, 2020 was the most fatal year on record in terms of drug overdoses. Physical distancing slowed the virus, but also contributed to economic challenges, to social isolation and psychological distress. In my practice, I saw it in the patients I cared for and in my health system, and this is research that actually Jerry did. We saw a more than doubling of non-fatal overdose visits in the first few months. Throughout the pandemic, Medicaid has taken a leadership role to address this crisis within a crisis. We've made it easier to receive care for addiction and supported virtual care, telemedicine, telehealth, to make sure that you can and our Medicaid members can access care over the phone through a video or through the telephone. And really our goal and what we've been working to accomplish over the past few years is to make sure that everybody in Virginia has access to the care they need when they need it, care that's personalized and evidence-based. We recently received an almost $5 million grant through the Support Act, which places emphasis on particularly ensuring access to care for pregnant and parenting women, those leaving hospitals, jails or prisons or residential treatment centers. It's more important, given all the stresses that we've all encountered, and many of you who are listening here, that you and your loved ones are covered and have health insurance. And so I'd like to invite you to visit us at coverva.org to find out if you or loved one is eligible for Virginia Medicaid coverage or for coverage through the federal marketplace. Thanks again, Representative, and I look forward to the conversation.
Thank you so very much, Chethan. And next we'll hear from Dr. Gerald Moller, Assistant Vice President of Clinical Research and Chair of Addiction Psychiatry at VCU. Jerry, over to you.
Thanks, Abigail. Just to give people a background on what I do, so I oversee as Division Chair for Addictions, I oversee the addictions clinical and treatment programs for VCU Health System, VCU Department of Psychiatry, and VCU School of Medicine. I also have several research hats at Virginia Commonwealth University, including, as Abigail said, the Associate Vice President for Clinical Research and the Director of the Kenneth and Diane Wright Center for Clinical and Translational Research. My specific area of research that I focus on is addictions treatment development. So with that background, I can say without a doubt that addictions are a major focus of clinical care and research for VCU and VCU Health.
Thank you so much, Jerry. I really appreciate our guests for being here. And Tim, I'll turn it over to you.
Thank you, Congresswoman, and to all of our guest speakers tonight, and to the thousands joining us. If you have a question that you would like to ask live of any of our guest speakers or the Congresswoman, simply press *3 on your telephone keypad right now. Press *3, and that'll put you in touch with a member of our staff, and we'll get your name, the area you're calling from, and the nature of your question, and we'll try to get as many questions as we can answered before this live event concludes this evening. Also, if you're joining us online, you can simply type your question right below the streaming player to have a question asked and answered. Let's start with a call from Pat, who's calling from Henrico County. Hi, Pat. Thank you for holding. You're live. Please go ahead.
I'm calling primarily to ask about the children. I'm very concerned about the children, as many were already in crisis prior to this pandemic. And I've been watching the news, and I see that they're talking about counselors being available for a day, maybe two. But this pandemic has gone on for a year, and I don't know that everyone's aware, but I have grandchildren, and it's really affected them, and I'm really concerned about the children. I just want to make sure that when they go back to school, or the ones that are at school, that they know that they have someone to turn to that will listen to them more than just a few days, and that they have referrals to go to, and that there's more than just one or two people in the school. Because I know that there are students, there are psychologists, social workers, and ministers that are willing to volunteer time to help with these kids, and they need it at least a year, since we've been in a pandemic a year. So I just want to make sure that somebody's talking to the people at schools, and as well to let them know that those children that didn't have a home prior, many people are unaware that Western Henrico County has a multitude of low-income people, and they feel that Western Henrico County is primarily luxury because that's all the housing they're building. And we need an educational program as well to let people know that we're really pulling for excellent, quality, affordable housing. Is there anyone?
Go ahead. I think we might have lost her. I hope you're still on the line for this answer. And I want to say I'm really grateful that you mentioned our community's children as our first question. And I'm appreciative that you're speaking out on behalf of your grandchildren and certainly the kids across Virginia and the rest of the country. So I'm going to start with answering this question from a federal perspective, what I've prioritized in our relief packages, and what my focus has been from a federal support standpoint. And then I'll open it up to our panelists, maybe Lisa, maybe Chethan, to give on the ground here local to Virginia their experiences and what resources might be available. So first and foremost, with the American Rescue Plan and with prior COVID-19 relief packages, we have recognized, we being federal legislators who pushed through and voted for this legislation, recognize the tremendous impact that COVID-19 has had on our community's children. I have 3 school-age children myself, and I know just the disruption that this time in history has caused for them. And that's notwithstanding so many of the other challenges that children face in their homes. So I want to let you know that from a federal perspective, we have invested and prioritized investments in grant programs and federal programs, the National Childhood Traumatic Stress Initiative, suicide prevention, pediatric mental health care access, significant federal dollars of investment into these programs to ensure that we're providing the resources to local communities, to states through federal support that they can then deploy on the ground to make sure that children are being supported. That's in addition to the support that with the American Rescue Plan, our direct aid to school districts. The direct aid to school districts is meant to ensure that our communities, the 10 counties I represent and communities across the Commonwealth and country, can make the investments in hiring additional staff, be it school counselors, like you mentioned, ideally so there's resources there beyond just a day here or a day there, but in fact that they have the ability to deal with the new reality and the needs that may exist on the ground. So my commitment is in being an advocate for these significant grants of support, significant federal investment in helping protect and contend with protect our nation's children and contend with any mental health challenges or stressors that they may be facing, and also supporting school districts as they endeavor to do the same. And so now I'll open it back up to our guests if they would like to add anything to this discussion.
Yeah, I too have had the children on my mind so much throughout this, and just wanted to mention a few things related to some of this federal funding that is coming down to Virginia. One being a priority on thinking about mobile crisis services for children, so that when families are struggling, they have someone to call and someone who, if needed, can even come provide support. As well as our community services boards, which often are known for adult services, they also, all 40, provide services for children as well. So it's, I really share those concerns with you. And so trying to really focus in on, how can we get these mobile services that are available in the community for the kids and families that need them, and hopefully additional opportunities for mental health in schools. Hopefully we'll be able to work together with Department of Education on that.
And if someone in the community is concerned about a child and their mental health, what's the first step that they should take to seek out those services?
I would say so. Specific to this district, one thing to look into is the CR2 Mobile Crisis Program that is running at CR2, CREST. CREST would be the best way to see it now. And really working with your pediatrician is a great place to start to share those concerns to whatever healthcare provider you already have, and they can help connect you. Or look up that local community services board and start there. Allies in schools, any doctor's office. It might take a couple calls, but you will get connected. And so, yeah, I would start with your pediatrician. I don't know if others would have other thoughts.
So the Department of Psychiatry at VCU runs the Virginia Treatment Center for Children, and so for this region, that's a resource for psychiatric care for kids and adolescents. They are available for access.
Excellent. Well, thank you so much. And we'll, again, put those resources and links available on our website and put them out in our newsletter in the event that anyone wants to look up either of those resources, Community Service Board or the VCU Center. Thank you so much.
Again, if you have a question you'd like to ask live this evening, simply press *3 on your telephone keypad or type it right below the streaming player if you're joining us online. Jim Rubin from Henrico County, thank you for holding. Sir, you're live. Go right ahead.
Hi, thank you, Representative Spanberger, for having these town halls. They're just wonderful. I just want to address the issue of the backlash, since we've brought up opiates and addiction as part of the discussion, that there's been a tremendous backlash, which means that people like me who are on disability and need pain management meds aren't often getting what we need. Because there's such a fear now that everybody will become addicted, and that's just not the case. And I wonder if there's research going on, or what's going on in that way, because the backlash is hurting a lot of people who need pain management. Thank you.
Jim, thank you for bringing this question to the forefront related to those who require pain management. And I'll ask which of our guests would like to speak to this one first.
Jerry, would it be okay? I'll take a stab, and then maybe
go ahead.
You can correct me.
Sure.
So first of all, thank you for that question. It's a really important question, and I'm so sorry that it sounds like you've had challenges personally with accessing appropriate pain management. So I just want to state that front and center. As a physician, this is something that we've been wrestling with as a community to really understand how we can, one, ensure that we provide appropriate pain management, and two, not overprescribe opioids, as you mentioned. And at some point, as a community of physicians, as a country, we've gone a little too far on the other side. And to the extent that we leave people behind, that is a problem. And to the extent that you feel that you're not able to get appropriate care, that is a problem. And so I'll say that there is a lot of work and recognition, certainly among my colleagues, and Dr. Jerry is actually one of my colleagues, that this is a problem, and that there is a way to for physicians to prescribe opioids in a way that's safe and clinically therapeutic. And there's a lot of research that's going on, not only locally here in Virginia, but also across the country. Some of the best places to go right now for someone who is interested and has tried multiple options for pain is a pain management specialist. And the best place to start is your healthcare provider to provide you that more advanced level of pain management. So with that, I'll pass it over to my colleague.
So thanks, Chetan. So as Chetan mentioned, this has been an area that we've struggled with. When I started teaching medical students back in the early 90s, we thought that, and we taught the medical students that if you had real pain and you were prescribed opioids, there was really minimal chance that you would become addicted to them. Well, we found out, unfortunately, that wasn't accurate, that there are individuals who are exposed, when they're exposed to opioids for chronic pain, they do develop an addiction. Not everybody, but it's a significant number. And so what's happened over the last probably 10 years is a focus on how can we, as Chetan was mentioning, how can we effectively use opioids in a safe fashion? And then what other non-opioid medications can we use to treat chronic pain? At VCU and the Department of Anesthesiology, they're looking at other non-opioid medications like ketamine for the treatment of chronic pain. So as Chetan mentioned, I think it's a great idea to go to a pain management specialist and talk to them about the risk benefits of opioids and the other opportunities for non-opioid pain medication. Another thing that people need to focus on for chronic pain management is that the goal of treatment of pain is really not total elimination of pain, but getting pain to a level where you can function. And function really should be the outcome measure that they're working with you on, and because that is ultimately how pain disrupts your life. If you're not able to function, you're not able to sleep, you're not able to go to work, obviously that's not acceptable.
And just to round out that question, I would also mention that there's been federal support to research in non-opioid chronic pain programs and treatment efforts. And so I've been a supporter of federal support to that research so that folks like the physicians on the line are able to have a whole array of options to provide support to those who suffer from chronic pain.
And just a reminder for all those joining us, for important updates or more information about the resources being discussed tonight, if you press *6 on your telephone keypad, that'll sign you up to be a part of our e-newsletter to get those important updates and to get more specific information about the resources that we're discussing this evening. And if you'd just like to ask a question live and you're joining us by phone, simply press *3 on your telephone keypad. Carrie Still from North Chesterfield, thank you so much for your patience and holding. You're live with the Congresswoman.
Good evening. First of all, I would like to thank you all for your hard work during this particularly difficult time. Second of all, I have complex PTSD as a military veteran, and I was wondering how much effort, what kind of research, and what kind of community outreach is there for expression opportunities? In other words, art has done a lot to help me navigate because even if someone else doesn't understand what I've done, it moves them to feel something, which is what I'm doing when I do it, and that is a source of validation. But when the times that I've been able to art in a group, then suddenly it's hours. And in that hours, we might find healing. So I was wondering, is there any efforts in this direction? And how can we take that from the school children all the way through the counties and the cities so that community by community, we find a way for us to be able to express what we've been through so that we can heal from it? Thank you.
Carrie, thank you so much for this question, and thank you for your service to our country, and thank you for speaking so honestly and openly about PTSD, but also the therapies and the community engagement that have been so helpful to you. I think it's so incredibly important for anyone listening to hear your story and hear a bit of hope in what you talked about. Certainly from a federal perspective, so much of the engagement that I have as a representative is continuing to advocate for incredible programs like art therapies or like community-based engagement. And the support that I can bring to those is really through the federal investments that we have marked as so important this year, particularly given increased and real challenges people across our communities are facing. But I'll open it up to our experts to speak to what sort of programs or research may be occurring here locally or nationally that Carrie and others who experience PTSD and are suffering from PTSD might want to learn about.
So it's interesting that you mentioned the overlap and the interaction between art and medicine. So VCU has a nationally ranked, I think they're ranked number 2 in the country, art school. And in partnership with our School of Medicine, they've developed, it's not my area, but they developed a research program looking at art and medicine. And so that's an ongoing research program there to try to look at the interaction between art and healing. So I think that's a program that's developed over the last few years. And so it is an area that VCU is interested in.
Thank you very much for that.
I'll just say one word if it's okay. I want to echo Abigail's words to you. Thank you for your service and for your courage in speaking about your experience, right? I recognize it's not easy, but it is very much appreciated. And all the other people listening to this will certainly take comfort in hearing you and hearing your story. One of the things that I've learned in my experience as a clinician is that so much of healing happens in relationships. And so when I heard you talk about being with others and what that means to you, it brought that up for me and for the patients I care for at the Motivate Clinic at VCU. And there is an active body of research here, particularly in the VA, which you might, as a veteran, you have some relation to. And part of that research stems from, not only the relationship between art and healing, but also between something called narrative therapy, where individuals write their story. They write about their experiences, and through that, not only take control of their narrative, but then are able to create, define, and identify meaning in that narrative and that work. And so just want to say thank you for sharing. And it's so important that we continue to promote, support these particular types of activities as is really part and parcel of what it means to heal. Thanks.
Our next question comes to us from one of our online questions. Again, if you're joining us online and streaming this event, you can simply type your question right below the streaming player. Robin Hanselman has this question. What role do you see peer recovery specialists with experience in addiction playing in helping increase access to treatment and recovery, as well as lowering the overdose rates statewide?
Excellent question. Thanks so much for submitting it, and I'll open it up to the experts. Lisa, do you want to start us off with this one?
I know. I think we're all three going to be very eager for this one, so I'll try to keep it brief. Yes, the role of peer support specialists and family support partners, it just really cannot be emphasized enough. We see it as one of the best bridges between, sort of where folks are right now, and taking that step into treatment and getting the supports they need. We have, with some of our federal money, have plans to invest further in the peer workforce, just ensuring that not only do peers have opportunities to engage in the entire spectrum of the healthcare system, crisis services, emergency room bridging programs, but also that the peer workforce itself has supports, and even under the pandemic circumstances can connect, via virtual connections and networking. So I'm so glad that in the community, this is becoming more and more something that comes to the forefront, because it really, it just absolutely cannot be emphasized enough as just such a key piece.
Jatham or Jerry, would you like to add anything?
Sure. I mean,
Jerry, go for it.
So the peer support and the peer recovery specialists, I think, are an integral part of especially getting patients into treatment. So addictions are a chronic medical disorder, so they need long-term care. And oftentimes it's difficult for patients to navigate how to get into that care and to access it. And so those peer recovery specialists, peer navigators, can help get patients from places like the emergency room or other, places where they don't know how to access that care, and actually get them into care and help them stay in care, which is so critical for long-term outcomes. And so Chethan in DMAS is supportive of peer recovery specialists.
And I guess that's a tee up. I'll say a word about what we do with peer recovery. So Lisa, you're correct. We're very excited, all of us, about peer recovery specialists, both what they represent in terms of personalized care, and really the power of someone who has literally been through addiction and recovery, really supporting someone else, and the meaning that gives them, and the meaning that gives the person who they're caring for, and the important bridge they serve between the community and the healthcare system. It's so integral into the type of care we want to build, and making sure that there's really no wrong door for anybody with a substance use disorder, with an addiction. As Dr. Jerry mentioned, it is a chronic disorder, and unfortunately it's very stigmatized, and peers can make a tremendous difference in destigmatizing and ensuring that individuals have access to care, effective care that can make a tremendous difference in their lives. And I feel so fortunate to be able to care for individuals with addiction and really see how the treatment we're able to deliver is able to transform the trajectory of their lives. So there is hope, and peers represent an important part of the treatment continuum. Thanks.
Our next question comes from our phone lines. Those joining us on the phone can simply press *3 to ask a question live of any of our guest speakers tonight or the Congresswoman. Brett Hermance from Henrico County. Hi, Brett. Thank you for your patience. On hold. You're live. Go right ahead.
Hi. Thank you. Congresswoman, I just want to start out by saying thank you for doing such an amazing job representing our county. Over the past year, we've seen a rise in the anti-Asian hate crimes and anti-Asian sentiment. Simultaneously, we're currently seeing tension increase between the U.S. and China. My girlfriend is Chinese, and we've experienced some hurtful interactions over the past few months. So I wanted to ask, what steps have you taken or do you plan to take to help combat the anti-Asian sentiment, especially as the relationship between the American and Chinese governments are seemingly collapsing?
Brett, thank you so much for this question. And to speak to, there's a variety of different things that I have done and will continue to do. First and foremost, any person with an elevated voice because of their role in the community, and I would count my role as a legislator as that, has an obligation to denounce hate and to be very vocal in expressing support for those who may feel impacted, who are impacted, or who may feel fear in our communities. And so I was proud to support and vote for a resolution in the United States Congress denouncing hatred towards the Asian American community, calling out the significant contributions throughout our nation's history of those of Asian American descent. And in more recent times, certainly since we saw the murder of 6 Asian American women in Atlanta, I've participated here locally to be supportive of those who are feeling afraid, those who are feeling concerned, and those who feel impacted, to demonstrate my support, to denounce hate, to denounce the efforts to make anyone feel that they are not a part of this community. And you bring up a really important piece because we are facing geopolitical challenges with China. And I am a member of the Foreign Affairs Committee. And so I have a significant body of work as it relates to the challenges that we as a nation face with the nation of China. And I think it's been incredibly important that we all, and I have found myself being increasingly and ever more conscious that when I am talking about the challenges that the Chinese government presents, be it in the development of technologies that could leave American people and infrastructure vulnerable to hacking, or when I am talking about the efforts to kind of position ourselves in from a geopolitical standpoint, the United States and our efforts to counter a rising Chinese influence, that is focused on the government. That is focused on the government of China. And I have attempted to be very, very thoughtful with how I phrase that differentiation, because that's about a country, that is the United States, and its complex relationship, difficulties, and partnership with China and with its government. And it has absolutely nothing to do with people in our country who may be of Asian American descent. And so I will continue to look for ways where I can lift up and speak to the valuable influence and importance of our Asian American community here in the United States. And I will continue to be ever more thoughtful and focused on ensuring that when I am speaking about geopolitical issues related to the country of China, that I am using specific and thoughtful language and clearly making sure that no affiliations or conclusions or negative ramifications can be drawn with people who are our friends and our neighbors, whose parents or grandparents or great grandparents at one point came from China or from any other Asian country. So thank you for this question, and I'm so deeply sorry that your girlfriend has felt anything less than utterly at home here in the United States. And thank you for raising this important issue.
Congresswoman, our next question comes from Henrico County. Anthony Ordain is on the line. Hi, Anthony. Thank you for holding. You're live with the Congresswoman and our guest speakers.
You're welcome. Congresswoman, from what I've understood, there is a problem with addiction, both drugs that have been prescribed and illegal drugs. Most of these people are encountering mental health issues. And as I see, you have provisions for them to speak or seek psychiatric care. But for the ones that don't realize that they are in need of psychiatric care, is there any solution to try and reach them?
That's an excellent question. I'll open this one up to our experts. From your experiences, what would you share as advice for a friend or family member who wants to reach someone who may be struggling?
So
I would.
I'll be glad.
Oh, go ahead.
Go ahead. I just I think with patients with addictions, as Chetan mentioned earlier, that it's really stigmatized, and many people don't think of addictions as a medical disorder or a psychiatric disorder or any other kind of a behavioral health problem, but more of a character flaw. And so I think the way to work with individuals and to try to engage them if they have addictions and they're not currently interested in or not seeking help is to approach them from with that non-judgmental stand where you're basically saying, I believe you have an addiction. It is a medical problem. It is not a character flaw, and there are effective treatments for it, but it's not a choice of whether you have addiction or not. It's a choice whether you seek treatment for addiction. And so I think that's been my experience in working with patients from that kind of a non-judgmental perspective often works well. Sometimes, however, there are patients who do not want treatment. And so you have to wait until they do. And that can be very difficult for families and loved ones that ultimately there's not a lot we can do to help people if they absolutely refuse to engage in treatment. And I will pass it on to others as far as their thoughts.
Yes, I was thinking something similar just about how difficult it can be, especially for families, when someone is struggling and you want so desperately to get them help. And I think patience and trying to help, trying to look for those ways that someone can be empowered, can see the choices that they do have, options that they have, and just keeping that connection there. Since, kind of no matter where we are, we're all kind of operating from within some sort of sphere of safety and trust. And, so the fact that these are folks that you do have a connection to, even when it's difficult, try to keep that connection there so that you can find opportunities to empower them. And I will also mention that here in Virginia, we have an initiative that's in progress right now under the Marcus Alert and Crisis Services that focuses a lot on making sure that that all first responders and behavioral health clinicians and a big focus on peer support specialists, that we're investing to make sure everyone has engagement skills and empowerment skills so that when we are meeting people, on some of their most terrible days, we're giving our best effort to try to engage them in those services.
And I'll just say one word here. My colleagues did an excellent job of really talking through what families and friends can do and how painful it is for so many folks if you see your loved one with a mental illness or addiction, but they can't see it themselves. And I'll go back to what Jerry said, which is really the best thing you can do is provide that non-judgmental support, as difficult as that might be, as painful as that might be. What I've learned is that addiction and often mental illness, as I mentioned before, is marked by stigma, often self-stigma. People carry a lot of shame and guilt when they come and see me in clinic. And by the time they come and see me, they're very isolated from family and friends. And that makes it even more difficult for them to access treatment. And so if if addiction and mental illness in its more severe form is isolation, then treatment is really connection. And so to the extent that you as a family or friend can be there for your loved one who has an addiction or mental illness, be there to listen and support them, you're doing everything you can to really make a difference in their lives so that when they are ready to make a choice to enter into treatment, you can help them and that really does make all the difference. Thank you.
And to our experts, if there's any resources, online resources, books that you all might recommend for friends and family who want to help a loved one who might be struggling with addiction or with mental illness, we'll follow up after this call, and we'll be sure to send those out in our newsletter as well for anyone who might be interested.
And if you are interested in signing up for that newsletter, remember, just press *6 on your telephone keypad. Our next caller comes from Chesterfield City. Daniel's on the line. Hi, Daniel.
Hello. Thank you, Congresswoman, for having me on. My question is about the K-shaped recovery that the economy appears to be going through right now. We're seeing the stock market taking off to new heights, and we're seeing a large number of working professionals achieving new heights in their career, working from home in industries that we previously never thought this would be possible. But at the same time, another portion of the population, unseen but just as viable as any of the others, is not experiencing any of these gains. In fact, they're falling behind. These are typically small businesses in low-income communities and individuals, perhaps working in sectors that are more service-based, that are not able to participate in this new normal that we're moving towards. What is Congress looking at doing to support these individuals?
Daniel, thank you for this question. It's a very important one for a whole host of reasons. And so just to speak to some of the things that we have done and some of the things that I'm focused on as an element of how we move forward and ensure that everyone experiences or is a part of our nation's economic recovery from this pandemic. So at the very earliest stages of the pandemic, we initiated the PPP program, which on its face is meant to ensure that our small businesses can stay afloat, but at its heart was ensuring that our small businesses can keep their employees employed. I've heard from employers across the district, just spoke with another one today, who have told me about how vital this program was for them to continue to pay their employees, keep people employed and paid while they were contending with the initial adjustment and ongoing adjustment to the pandemic, to ensure that there were supports for those who did suffer job losses. As you noted, so many individuals were able to pivot their laptop to their kitchen table and continue working, certainly impacted, but still employed. And so for those who lost their jobs because of the pandemic, we instituted federal support, additional support to those who were impacted through federal support to unemployment programs. We have just extended that again because that challenge continues to exist. For those experiencing, significant economic hardships, we pursued and voted on bipartisan programs to support food security programs and housing security programs so that those who were faced job loss or loss of hours were able to have additional resources to keep food on the table and a roof over their heads. But what you talked about is the recovery. So what comes next? And this is really our focus at this point. And the White House made an announcement today, and the president speaking to this evening, the discussion of the American Jobs Act and what the future will hold for our country. We've long talked about the need for infrastructure development in our nation, certainly our infrastructure repair, roads, bridges, tunnels, broadband connectivity, our electrical grid, and the resiliency of that system. These are all elements that in some cases with broadband connectivity just don't exist. In many cases, roads, bridges, tunnels are facing significant disrepair. So making significant investments in our nation's infrastructure is also a significant investment in getting people back to work, in good, steady jobs as we invest in the basic infrastructure of our nation. So that's part of it, that workers and skilled laborers, ensuring that there are job opportunities as we are making those investments in infrastructure. Another element of that larger effort is the care economy. So the workforce that takes care of elderly or the sick, home health care workers that take care of children, as daycare workers, ensuring that they have support and the ability to render their services that are so incredibly vital, caring for the most vulnerable. So these are elements of a not yet legislative text, but the plan that we in Congress are working off of as we plan for the American Jobs Act moving forward. And then I would note that there's two pieces of legislation, one that I introduced and one that I helped introduce, that I think are also important to this recovery. And as you mentioned, Daniel, ensuring that those who have been impacted so significantly, because there's been those who didn't lose, there's been significant disparate impact. But I have two bills. One that I introduced, which is focused on allowing people to use 529 plans to pay for certification programs. So either someone who's looking to change their career and needs to go through a certification program, or someone who's graduating high school looking to start a career. I was just on the phone today with constituents and a variety of folks talking about the shortages of truck drivers across this country, good paying jobs. And yet here in Virginia, we just simply don't have enough. And so being able to use 529 funds to be able to pay for those programs is incredibly important. And so that's one piece of legislation. Of course, 529 programs require that someone invest and put their money into those savings vehicles, which isn't always an option for everyone. And so with that, there's another bill that I helped introduce that's focused on ensuring that those who are Pell eligible can utilize their Pell grants, not just for a 4-year education and not just for longer term, full semester worth of credits, but some of those shorter certification programs that are so vital to their ability to, jump right into the job market or upskill themselves in a way that will help them be able to get a job as we continue our recovery out of this pandemic. And I could go on and on, but I will stop there to make sure we have time for more questions. But thank you so much for this question, Daniel.
Congresswoman, our next question comes from one of our participants online, from Don Shelley, Spotsylvania School Board Chair. First, she'd like to thank you for your support for our schools. But the question is, does the latest support that you mentioned put mental health counselors in schools, and can the funding be used for salaries for those positions?
So thank you so much, Don, for this question. And for anyone who might be a local legislator on the line, thanks for listening. And for any public servants on the line, the answer to that question is the American Rescue Plan dollars can be used that's money coming through the Department of Education, can be used for mental health services and supports. And so that includes if a school chooses to use those funds, or a district chooses to use those funds to hire additional staff to meet the mental health needs of children in school. Yes, it can be used for that. And so we'll be going through, it's a pretty expansive plan, certainly significant support to our community schools, significant support to our local communities with the American Rescue Plan. And so I welcome anyone who has any other detailed questions about how those funds can be spent to best serve our community to be in touch. And Dawn, I hope you'll join us for one of the upcoming meetings that our office is going to be hosting to walk through those plans. But the answer is yes. American Rescue Plan funding can be used to provide the supports that are necessary in schools, and that if a school chooses to hire a counselor, that's a great usage of those funds.
We have time for one more of our callers online, and Belinda is calling in from Henrico County. Hi, Belinda. Really appreciate your patience. I know you've been holding for quite some time, but you're live with the Congresswoman and our guest speakers. Go right ahead.
Oh, thank you very much. And thank you all so much for this positive, town hall, especially highlighting mental health. It's such a great opportunity, and so many people are silent about it, and the support has been wonderful on this call. And I just wanted to quickly ask about shining a light on geriatric mental health. I'm a caregiver for my mom, and a little bit uncharted territory about psychiatry and medications for seniors. And she's experiencing, at this stage in her life, it's PTSD, and she's been a rock for our family, of course. Well, she's just the greatest. And I have complex PTSD, so I have, it took me 34 years to seek help, so I encourage everybody not to give up. But also, when I did, I have an excellent therapist locally in psychotherapy, and she's the best. But I wanted to say the elderly are a little bit ignored and overlooked in general in America, and it's just a little bit of help and guidance for getting her help would be great.
Well, Belinda, thank you so much for your question. And in your question, thank you so much for sharing your own experiences. I think a theme that we've been talking about throughout the evening is the importance of community. And I think certainly hearing your story will be helpful to those who might be listening, who might themselves be struggling, who might not have yet sought the help that they need, and hearing that though it took you years yourself that you sought that help and are so enthusiastic about it. But that leads us to the discussion related to your mother. I'm so sorry for the challenges that you all are facing. And I appreciate you bringing up the topic of care and for the needs of older Americans, particularly who might have in their later years increased need for mental health services. And so I'd open it up to our panelists at this time to provide any resources or their thoughts on this particular segment of our community that might truly need services, and how to help the family members who would be helping them in finding it.
So Chetan, I will pass this one to you to start off with.
Okay, sounds good. Happy to. So again, want to echo Abigail's comments. Thank you for coming forth and sharing your experience. And your mother sounds like she's lucky to have you, which is really great. One of the you're mentioning one of the challenges for mental health for our elderly, and I think one of the biggest challenges is the loneliness epidemic. It's something that affects many of us, both young and old, and is particularly prevalent among our elderly, and has been particularly difficult during COVID-19. And so, to the extent that you or others can connect with those who might be isolated, lonely, particularly elderly in your life, please do so. And that by itself makes a big difference, right? Knowing that someone has a connection and support makes a big, big difference in terms of isolation. And we know isolation and loneliness by itself can be a risk factor for poor health outcomes, for cardiovascular disease, for dementia, for premature mortality, premature death. And so really profound consequences from isolation and loneliness. In terms of resources to access, I would just highlight a few. So one is you can always reach out to your local AAAs, area agencies for aging. There are a number of resources from national organizations on geriatric psychiatry and mental illness, and we can I can make sure that send them to the representative here to post in the newsletter or on the website. And I would also put up that perhaps your mother could access telehealth services if there isn't a particular psychiatrist that specializes in geriatrics in your region. And so one thing to do is either go to your healthcare provider. You can also call your health insurer. And this is a little trick that I learned as Chief Medical Officer at Medicaid, is that your health insurer can be a resource in terms of pointing you in the right direction to, let's say you need a geriatric psychiatrist or a therapist that specializes in geriatrics. They can direct you to the right person. And you can receive that care via telehealth. And so that could be another option. And I'll stop there and just thanks again for the question.
I'll add one more resource. Just thinking about what's called the Virginia Geriatric Mental Health Partnership. Could be, somewhere to access additional resources. I mean, connect to folks that are working through similar situations, providing that care, and just really might provide an avenue to access those specialized geriatric behavioral health services. And I'll provide the link to that as well.
Thank you.
Congresswoman, if before we close out, as we have come to the end of tonight's live event, I just wanted to turn it back over to you for a moment for any final thoughts you may have with all the great discussions we've had this evening.
Thank you so much, Jim. Well, I want to thank our experts for being here today. Thank you for adding so much to the conversation. We have seen in our office a significant uptick in constituents reaching out to us with concerns related to mental health, related to addiction, and related to the resources that they or a loved one need. And so I'm grateful that our experts were able to join us tonight. I hope that you all found this informative. If you're listening on the line or if you're watching us online, thank you for joining. This will be available if you want to go back and watch this town hall. It'll be available on our website and on our social media. But I want to say to anyone who's experiencing challenges tonight or who's suffering from mental health challenges or from substance use disorder, that there is help available. We've heard some stories of strength from some of our callers tonight who themselves have experienced PTSD and mental health challenges and have worked to provide support to their loved ones. So I urge anyone who may need support at this point in time to please seek it. We've heard the Virginia COPES Warm Line. This is what Lisa mentioned in her introductory remarks. And I just wanted to make sure that that number is available to anyone listening in. It's 877-349-6428. Again, it's 877-349-6428. And that's the Virginia COPES Warm Line. To everyone listening in, I hope you're doing well. Thank you for joining us. I appreciated the opportunity to answer your questions. I hope you stay safe, and I hope you'll join us for the next telephone town hall. And again, to our experts for joining us, thank you so very much.
Thank you, Congresswoman, and thank you to all of the thousands who joined us this evening for this important telephone town hall with Congresswoman Abigail Spanberger and our Virginia mental health experts. We appreciate the opportunity to answer your questions, but if we were unable to get to your specific question this evening, you can call our district office at 804-401-4110 during normal business hours, or go to the website, spanberger.house.gov. Thank you again. Stay healthy and safe, and have a great evening.